Kitapçıkta evet, kitapçıkta sadece bağımlılık olarak geçiyor ama sanki çok sıradan bağımlılıklarmış gibi ben algıladım çünkü
Well, in the booklet it is said that these are extraordinary addictions, but these are quite ordinary, and I think they are seen quite frequently. And before talking about exercise addiction, I would like to talk about exercise itself. It is composed of regular exercise plans, structured and repetitive complicated movements, and if it is done at adequate amount of frequency, then it's quite healthy. In psychiatric case studies, the excessive amount of exercise may lead to physical damage and the distortion of family life. And whether is this an exercise addiction or compulsion, there are different ideas, and there are 6 symptoms to identify addiction. First of all, there should be excessive mental effort, mood swings, tolerance, withdrawal, or abstinence symptoms, and personal conflicts. And when we look at the primary exercise addiction, it's a behavioral addiction, but in secondary exercise addiction, first of all, it is seen together with a dysfunction, and most of the time it is eating disorder, anorexia, or neurosis. In primary addiction, the basic aim is to do the exercise just like the male that you see, but in the other one, like the lady, it is a secondary addiction because the main aim is to lose weight. And 26% of male are addicted to running, and 3.6% of all the exercisers, that they are prone to addiction. When you look at etiology, there are a couple of hypotheses. Endorphin activity in the brain is present, and it is also triggering morphine production, and it can be used in terms of explaining the addiction. And thermogenic regulation hypothesis says that the anxiety is reduced, therefore the negative findings can be avoided, so this can be the underlying etiology. Catecholamine, as we know, are active in the reward mechanism, and also eliminating anxiety and mood swings. And also cognitive evaluation hypothesis will be mentioned later on. As a motivation, we can talk about 4 different types. First, we have the external regulations, that is, the people are appreciating those who are carrying out personal exercises. And also we can talk about the prevention of emotions. That is, we can talk about the prevention of concerns, anxiety, etc. And also, we can talk about a defined regulation, or the person can regard this as a lifestyle. Suggested a cognitive evaluation hypothesis. So first of all, the person starts to exercise to cope with stress, and then it becomes a lifestyle. And then when compared to alcohol, tobacco, or substance, this is a rare form of addiction because it requires a serious level of physical effort, and after a certain amount of time it becomes quite difficult. In treatment, particularly in the early period, in childhood, in order to prevent its onset, self-control should be taught, and moderation should be taught by the parents and teachers to the child. So all these possible interventions most of the time should prevent exercise, however it should encourage the exercise as well. That is, prevention of excessive amount of exercise and encouraging exercise should be in balance. Creative exercise should be tolerable, and it is then a wanted and desired factor in order to be healthy. However, about the course of exercise addiction, we are not very knowledgeable. When we talk about pornography addiction, first of all, what is pornography? It is aimed at increasing the sexual senses and thoughts, and also it involves just demonstrating the sexual organs. And in fact, we don't know what to expect about the future of pornography. Well, in the old movies we hear the sentence of "you can have my body but never my soul," but I think it's going to change. Well, Benjamin Rush suggested something about 200 years ago. He talks about the pathological structure of the sexual drive, and in 1886 Dr. Richard von Kraft suggested that it can be a psychiatric disorder, and in 1978 hypersexuality is included, it is suggested to be included in a behavioral disorder spectrum. In some societies, the sexual addiction is defined as 3 to 6%. In college period male, 87% looks at pornography, 50% looks at pornography on a weekly basis, and we can say that 12% of all the websites are pornographic websites, and there are approximately 4.2 million pornographic sites. And when we look at the search engine, it's approximately 25% of the accesses are about pornography. And in those times, actually in 2006, the income out of this industry was quite high. And when we look at the criteria, we have pathos criteria. There are 6 questions that are asked, and the abbreviation is formed by the initials. First of all, do you find yourself frequently thinking about sexual thoughts, and do you hide those feelings from others? And did you seek help for the sexual behavior that you did not like? And did you hurt anyone because of these thoughts? And once you have sex with someone, do you feel distracted? And we see that some parts of the brain are active in this disorder. In the nucleus accumbens, delta phos B is increased significantly, and through dopamine, the reward mechanism is actually triggered, stimulated. As risk factors, AAA is the case. That is, there are 3 primary factors: accessibility, affordability in financial terms, and anonymity. And I think the most important factor, as mentioned in the literature, is anonymity. Of course, there is a process. First of all, the person discovers it, then he starts to try, and then the number of trials is increased, and then there is great desire, and then the desperation goes on. So we should check the moods of the people. First of all, the person may feel himself limited when he is offline, and also when he is online he feels himself more excited, attractive and courageous. In the treatment, we can say that Patrick Carnes suggested some concrete steps. 2 of them are related to the person himself, and 2 of them are related to the computer or the tools that are used. For instance, he suggests that the computer should be placed in a place where it should be where it can be seen by everyone, and it should be used during daytime. And for also sex addiction, Carnes suggested some practical guidebooks, and also there should be a homework-based approach, and some researches should be read by the patient, etc. And also the partners should be involved in the treatment. The sexual behaviors and masturbation should be controlled, and also the triggers should be avoided because of relapses. Self-care, nutrition, physical exercise, getting rest, insight, friendship and relations are the important supportive factors in treatment. Pharmacological treatment, first of all, the anxiolytics, the antipsychotics can be used, and also if there is irritability and stimulant effects, then they can be used. Some mood stabilizers can be used, and imagination is quite high in these patients. Therefore, mood stabilizers are decreasing the aggression and these kinds of imaginations. Stimulants can also be used in risk-taking individuals. Naltrexone, as mentioned by Kerem, there's only one case report, and the study is related to sex, and it's only at a trial level, and also there are some gambling-related studies as well. Anti-androgens can be used in order to decrease the libido, and prosexual medications can be used, because sometimes people can have problems with their partners in their sex life. Therefore, prosexual can be